Hi, good morning Ainsley. My name is Edward Strauss. I'm your invigilator for the OET speaking session on the 7th of February 2020. How are you doing?
Hi, good morning. I'm good. Thank you for asking. How about you?
Well, I'm great. Can you tell me your full name for the record, please?
My full name is Ainsley West.
And what is your candidate number, please?
My candidate number is 200300662.
Thank you. And you are taking this test as a nurse. Is that correct?
Yes, correct.
Thank you. Can I see your ID, please?
Sure. Here it is.
The warm-up questions are not assessed, and are a chance for us to get used to each other's voices. We'll just talk for 2 to 3 minutes.
All right.
What all are the different roles of a nurse?
Nurses are continuously monitoring and evaluating patients. Nurses' responsibilities include coordinating with multiple specialists to ensure that their patients are adequately on the road to recovery. A nurse may come in many forms. Specifically, some of the things nurses do on a typical day are conduct physical exams, take detailed healthcare histories, listen to patients, and analyze their physical and emotional needs, provide counseling and healthcare education to patients, coordinate care with other healthcare providers and specialists, stay current with advances in healthcare options, medications, and treatment plans, draw blood, and perform other health-related testing, check a patient's vital signs.
Your views on gender disparity in nursing.
Nursing requires complex knowledge and skills from many scientific fields. As a scientific profession, all genders have equal ability to excel in nursing. There is no gender predisposition to the profession. More male nurses would help shift the focus on the nursing profession to a balanced view of science and caring. The fact is that nursing is based on skills, knowledge, science, and expertise. Two things that make the nursing profession female-centered are, the first one being, nursing is majority female obscures. Secondly, false stereotypes about women in nursing. The misleading beliefs that women are more nurturing than men. However, the most important aspect of nursing is to comfort people. These two misrepresentations continually reinforce each other. In searching for a reason why nursing is predominantly female, people fall back on the myth that women are more nurturing. The gender, nurturing, and soft science myths about nursing are long-standing and deeply rooted. Increasing the percentage of male nurses would be very impactful in changing them.
Is there any specialization that exists in nursing, like that of doctors?
There are specializations for nurses as well. Some specific nursing fields include geriatrics, critical care, pediatrics, treatment planning, and case management. Mostly, nurses are skilled in many fields, and may choose to focus their trade specifically on certain types of care. Different types of specialized nurses include nurse anesthetist, family nurse practitioner, labor and delivery nurse, an ICU nurse. An ICU nurse works with sick newborn babies. Travel nurse. To become a travel nurse, you must hold an associate's degree. Neonatal nurse. A neonatal nurse works with sick babies. Ambulatory nurse. An ambulatory nurse works specifically on an ambulance for numerous emergencies. Pediatric nurse. An even nurse educator, who instructs and teaches aspiring nurses.
Why become a nurse?
There is an old adage that you need a doctor to diagnose you, but a nurse to save your life. We can all recall a time when a nurse was needed most, from a normal checkup in a doctor's office to an emergency situation, and even an outbreak, like COVID-19. Most people can think of a nurse who has played a significant role in their life at some point in time. To become a nurse is to become someone who improves and saves the lives of others. If you are looking for a career where you can put your desire to help others to excellent use, becoming a nurse is an excellent career path for you.
Beyond hospitals and clinics, where do nurses work?
Not all registered nurses work in hospitals. You can find a nurse in a wide variety of healthcare settings, including doctors' offices, urgent care centers, pharmacies, schools, and many other locations. Nurses have the ability to use their skills to meet the needs of their patients, pretty much wherever they are located. For example, many nurses now assist the elderly or disabled in their homes. Some common places where nurses work include hospitals, clinics, offices, schools, pharmacies, ambulance and helicopter, home health care settings, senior living communities, Army, Navy, etc.
Great. Thank you very much for sharing that. So, let's move on to roleplay now. I'll take the part of the patients, or perhaps a relative, and you'll take your professional role. The purpose of the roleplay is to get evidence of your ability to communicate effectively with patients. Use your ability to fulfill as much of the roleplay as possible. Do you have any questions?
No.
You have up to 3 minutes to prepare the roleplay. You will start the roleplay after that time. I'll let you know when 3 minutes are up. You can ask me if there's anything you are not sure about, and you can make notes on the roleplay card if you want to. Here's a pencil for making notes.
Thank you.
You can look at the card during the test, but you must return it to me at the end of the test. Please start preparing now. Thank you. Your preparation time is over. You can now start your roleplay. Don't worry if I stop you when the time is up.
Hi, good morning, Edward. I am your attending nurse, Ainsley here. How are you feeling now?
Hello, good morning. I am doing better, nurse.
That's great to know. Nevertheless, you seem to be confused. May I know what is bothering you?
Well, nurse, I am a bit nervous about my future health.
Your concern is sensible. Edward, your present condition is quite satisfactory. Do not overthink or stress too much in this situation. It is really possible for you to have a gradual transition back to normal life.
Okay.
Edward, I can reassure you that a full recovery is possible for you if you follow the doctor's advice.
Sure, nurse. I will follow the doctor's instructions.
Good to hear that. It is also very important that you should be taking medications regularly, without any failure.
Nurse, are all medications really necessary?
Yes, of course. Your doctor has prescribed them, according to the vital signs, and considering your health conditions.
Okay. Nurse, will I be able to go back to work soon?
Being a businessman, I can understand how important it is for you to get back to your work sooner. And, yes, Edward, you can be back to your normal life soon. Perhaps there is a necessity to have lifestyle modifications for you.
Oh, really?
Yes, Edward.
Could you please explain to me in detail?
Yes, of course. From your case note, it is clear that you have a smoking habit, and also you are overweight.
Yes, nurse.
Edward, your current health condition demands to stop smoking. If you continue to smoke, your health will become much worse in the very near future. The importance of giving up smoking is at its peak. Perhaps, I would say, quitting smoking is inevitable for you at the moment.
I can understand what you mean.
Edward, quitting smoking is not a difficult task. I can provide some assistance for you.
All right.
Firstly, you can rely on nicotine gums whenever you feel like smoking for the initial days. Later on, your smoking habit will get detached from you. In case if you feel a bit more tempted, you can use the electric cigarette instead. Also, there are smoking cessation groups, and they provide greater support in the mission of quitting smoking.
Okay, nurse.
Edward, the second thing is about your excess weight, which will also affect your health adversely. You must mind your diet and do exercise as well.
Oh no.
I know, being an entrepreneur, you will be having a busy schedule. Time for exercise and managing your diet will be difficult for you. However, you should find some time for doing exercise.
Nurse, I don't think these lifestyle changes will be easy for me. I am really concerned about making changes to my lifestyle.
Edward, your concerns are understandable. Some practical ways of cardio exercises are walking while making phone calls, using the staircase instead of elevators, taking a minute break for breathing exercise while in the office, which is also a stress reliever. Aren't they really affordable for your time?
Yes, of course. These can be made into practice.
That's really appreciated. Also, while considering a diet, avoid fast foods, many sugary items, soft drinks, and, including vegetable solids 15 minutes before your meal, avoid carbs during nighttime, all will be very effective for you.
Yes, I got it.
These are small and effective ways to begin with. Isn't it, Edward?
Yes, I think I will be able to follow it. Nurse, could you advise me about a suitable diet with an exercise routine as well, so that I can make it into practice later on?
I am glad that you asked me this question. Edward, I will arrange a consultation with our dietitian and physiotherapist for you, and they will guide you through the tailor-made practices for you. Does that sound good?
Yes, nurse, that will be of great help.
I would like to draw your attention to the importance of regular rest periods between activities. Do not push yourselves to the limits. Maintain a comfortable way of doing exercise.
Okay.
Great, I hope I have cleared all your concerns.
Definitely, nurse. So, I can lead a normal healthy life if I follow all these practices, isn't it, nurse?
Yes, Edward. Be confident and optimistic. I wish you a great healthy life ahead.
Thank you, Nurse.
You are very welcome.
That is the end of your OET speaking roleplay. All the very best.
Thank you. Thank you for watching. Please, like this video and encourage us.
Subscribe and stay tuned for more videos. Kindly comment your suggestions and help us do better.